who will show to us how to do this important step of medical examination before the injection that will be done by Dr. Benedetto. Thank you, Leonardo.
Thank you, Olivia. We have a very nice lady here, and this lady, you can see, has a beautiful skin, a little bit of sun damage, and a little bit of tendency to rosacea. It's a sensitive skin. She got many different procedures in the past, and you can see that we have a little bit of hyper definition of the a mental lip groove here with a deep wrinkle here. She tends to overcontract the muscle, the mental muscle here. So maybe I think that we need to relax this muscle with botulinum toxin to make it smoother and to increase a little bit to improve this area with the IG prime filler. We have the starting of marionette lines, so we need to redefine the marionette lines and to give some support to the lower lip to make it more happy. We need to define also these, the nasal, yes? Yeah. Yes, we need to overemphasize and to the nasal labial groove here to get the piriform fossa. We need to get smoother. And then, touching this forehead with botulinum toxin is a risk in the 65 years in this kind of patient, because she already has a cosmetic tattoo, which is already defining something which is not very, attractive because it's too flat here. So it's very difficult to modify this. We can roll this with maybe with a filler. So I'm going to talk with Nino if we can do something like this. We can hyper elevate here the lateral part of the eyebrows to make it more attractive. We need to smooth a little bit the jawline, increasing the volume at the mandible angle. And she got a little bit of jowl here, as you can see, so we can correct this area and make it smoother here. So volumizing, the cheekbones here, the lateral cheekbones, volumizing the angle of the mandible, botulinum toxin here and here to relax this kind of golf ball, deformity that she's overcontract the mentalis muscle. We work on the piriform fossa. We work on the lateral, the lateral commissure with the marionette lines at the beginning. And I would like, she has a frontal nasal, angle, which is very much defined. We can even smooth this angle if you want. And frown for me. Yes. The posterior muscle is quite, tough, so we can do something here, to relax this. Yes. And can you frown again for us? So I would like to concentrate just very gentle with botulinum toxin here in this area. I wouldn't like to touch this area.
No, we can do this.
Yes, but very little.
Little.
Okay.
I always do little.
Okay, good.
Am I on?
Yes.
Okay, so I was at another session. I gave a presentation. I'm sorry I'm a little late. And this is the first time Patrizia and I are meeting. Pleasure. I was looking for you at 11 o'clock. You were not here. 12 o'clock, you were not here. 1 o'clock, you were not here. Okay, so that's okay. So I make you laugh, and I understand how your face moves. Excuse me.
No.
So do you understand English, or?
No.
No, pas anglais.
Yeah.
Okay, pas
Smile.
français pour moi.
Yeah.
Okay. Yeah, frown for me. Frown. Français. 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 Fort. Okay, so you're right.
Yes.
She's got a inverted omega pattern. She's got an inverted omega because it goes this way. So the procerus is a little stronger even than the corrugators. So what I'd like to do, because there was the other session, they talked about the dipping of the medial brow. It's really important that we also treat the depressor supercilii. So we will do the procerus, depressor supercilii, so we get something like this. To know if this moves, you do this to the patient to see how much laxity there is. So I'd like to do the botulinum toxin treatments first, and then we're going to do the filler.
Yeah.
Because I don't like to inject botulinum toxin in filler.
Yeah, exactly.
In filler. So I do that first, and then I usually have the patient come back in 2 weeks, 3 weeks. But so we're going to do depressor. Why don't we start? The syringes are ready. Raise your eyebrows. No.
Up.
Yes. Okay, so here's how, I'm sorry. Here's how I usually like to do, because she has relatively flat eyebrows. So I want to try to raise the eyebrows. So I will do, here are the points where I will inject, but it's not coming out. I do the points like this. Do we have a better marker? Sorry, and we have, I'm going to try to keep on time. The pencil, how about the pencil?
They're not working.
And in the meantime, if there are any questions,
yes,
why don't you see if we can, so to make sure, okay, this is good, okay. To make sure that we give the opportunity for the frontalis to pull up, because now we're going to relax the depressor, we go a little high here, and then I also want the frontalis in the middle of the brow to pull up a little bit like this. And this is all the result we're going to get. So we're going to do like this. And then she does have a lot of laxity here. So we may not eliminate this line, but we can always take care of that at another time with a little bit of filler. And then I come down this way. So we have the frontalis here moving the brow in this direction. So we'll do the same over here. So I try to keep it as parallel as possible. We go a little higher and a little here. And that's basically all I do for the forehead. But raise your eyebrows again. Raise eyebrows up. All right, raise them up again. You go like this, and you see a lot of wrinkles in the center, and bring your eyebrows down. Okay, so all these points are 2, and this is 1. Okay? There may be a question.
Yes.
So depressor, Proceres, Francais. Okay, fort. So now you see the dimple. This is the tail of the corrugator, and I feel here, this is the strongest part of the belly, and you feel the orbital rim, so it's about 1 centimeter distance. And then you see the corrugator dimple, and this is where you inject superficially and where you inject deeply. So, Francais, otra vez, well, I'm speaking all kinds of language. Okay, so raise your eyebrows. Up. Monte. Okay, because I want to feel the border is here. Francais. Okay, and I already marked it. Okay, so that's that. So now we have the upper face and smile. Souris. So here we go. Again, feel the orbital rim here, about 1.5 centimeters. Souris. And then we go right here. No farther medial than the lateral canthus, and no farther lower than the upper border of the malar process. And these are the 3 points that I do my injection. And for her, because of the strength of the orbicularis and the depth of the wrinkles, I'm going to give 3 units. Sometimes I give 4, but I'm going to play it safe, and we can always do it again here, here, and here. Okay?
What about
Can you
Nino?
see that?
Nino, a little bit here to weaken.
Yes, no, okay, so sit up for me, please. It's really important to see that her eyebrows are asymmetrical, okay? So I usually have the patient close their eyes, ouvert, and so when they do that, the frontalis will pull both brows up. Do you have a mirror? Okay. So the other trick is I give the patient a mirror, and I say, how do you say close? Fermez. In the miroir. No, okay.
Look in the mirror.
Look in the mirror. So this is a little higher. So I will put 2 units here, right here, just to keep it elevated, but I will put 4 units, sometimes 6 units here. Okay, so and maybe I will do, maybe I don't do any over here. and I do 4 units there. Okay.
See, with this kind of eyebrow can be misleading because it's the tattoo.
No, it is yeah, you're
Yes.
right. You're absolutely right. Yeah, and that's where
And that's
it's a
where
little,
you must be
but you
careful.
look at the muscle
Yeah,
movement.
sure.
Okay, so do we want, say, French fries on Friday in France? Yeah, French. No, French. Fry. No, go. No. French. So to see the action of the mentalis, you have to
French.
say it in French. Give me a French.
Français.
So she doesn't move too much.
Yes.
No. So I don't think we're going to do the mentalis.
No.
Go like this. No, like this. Souris con la bouche
Fermé.
fermée.
Fermé. Et tu descends, non, tu descends vers le bas comme ça.
No, like that.
Là, comme ça. Tu descends vers le bas. Tu fermes ta bouche, ferme la bouche et descends vers le bas.
All right, so her DAOs are to, if you cannot move the muscle, then don't treat it, okay? But I would have treated her DAOs right here. I would have treated the mentalis right there, so we leave it alone. And she doesn't have the lips, the barcode, so we should start. Where is the
Botulinum toxin.
botulinum toxin, please?
Here.
Do we have any comments from the audience? Do you do things differently?
Yes.
So the other thing is, which I did not show you, and I'm going not to mark, oh my God, is that I am going to put 2 units in the lower eyelid, okay? And I usually walk around the patient.
Absolutely.
There's 2. You're going to take everything away?
Yes.
Okay, we take everything away. Here we go. Try to get questions from the audience. I would really appreciate people asking questions.
Well, Nino, why do you...
So I'm coming this way.
Yes.
All right, so understand, I'm doing the lower orbicularis. I'm going to do 2 units. Here, look up.
Regarde en haut.
And with a lot of light, we see where the blood vessels are.
Voilà, t'es bien, relâche-toi.
2 units. And then I come around. I'd like to do this area first because we do not want to frighten the patient. They understand that it's not very painful,
Tu relâches.
and we're about 2 to 3 millimeters from the orbital rim. It's not very painful, and then I gain their confidence. And
So
then
what
this
is the purpose of this injection?
to open up her eyes and to relax the muscles, you see. So this is going to be like this, but she's got a lot of static wrinkles, but
Yeah.
it will help keep the souris.
Yeah.
Look at the difference on one side to the other, okay? So it'll relax the orbicularis oculi. So I'm going to do these 2 now, and all my injections are superficial.
Yeah.
Souffle bien. Relâche-toi.
So bevel up, when you inject, bevel up close to the skin surface,
Yes,
and you see a little bleb.
Yes.
See?
Souffle bien.
No more. This is to relax the orbicularis muscle and to help the frontalis to be lifting. So there is a balance between the 2.
Right.
And Nino now is weakening the orbicularis.
and I'm going to go all the way around.
Yeah,
So
exactly.
here
Please, a question,
is
please.
a little bit of,
I am here.
Yes, we have a question from the audience.
this
To
is
the
3
point
units.
Here below, you have the normal dilution, classical dilution?
Yes, it's a classical dilution. It's 1-to-1, I think.
Yes.
Yes, it is.
My dilution is 1 ml per 100 units.
Yeah.
So each notch is 1 unit. And then we do this one. Now, again, remember, you have to be really high right here
Relâche-toi bien, Patrice.
and very superficial. And I pull down the skin.
Voilà, relâche.
And these are 100-unit syringes, but I only have 20 or 30, so we don't hurt the patient. So I'm not doing any on this side because I want the natural pull to occur, and I weaken the depressors on the right side so there's no pulling down, so hopefully this brow will look like that when it's finished, next week. So we do the same, like this. Are there no questions? Just ask the question. See, these are all superficial injections. Ask the questions.
So
and we will hear you. We can't see you, but we will hear you.
We are injecting very superficially because how thin is the orbicularis muscle? It's very thin, it's very close to the surface.
And it's close to the surface.
So you don't need to go deep in this area.
Am I hurting her? I'm not hurting her, right?
You see the technique, very superficial, like you raise a bleb, and then do you massage, Nino, after the procedure? Do you massage?
No, sometimes. It depends on where. Maybe the forehead, but not necessarily so.
Okay.
So raise, Zobra, there you go. So here we go. So, and never inject inside the mark that you make. So these are 2 points. 2 points, so I want this to be nice and high, so right about here, and I'm a little higher, as you can see. 2 points, intradermal, subdermal, and this one, I want this to raise a little bit more, so I go a little higher here. If the lines are still there next week, 2 weeks from now, then we can put a little filler, a little polydensified filler in that area. Let's see. So we do this again. I hope I am out of the, so try to stay parallel. So here, and then we got to start the filler soon. Okay, so here, this is finished. I need one more syringe. Assistente.
Assistente where?
Yes, just ask,
yes,
please.
ask question, please.
2 units again, high.
Yes.
Say that again.
The question
when
is,
you inject the frontalis, what do?
Normally you have a lowering effect on the eyebrow.
Well, that's because you're too low. You're going to get a nice elevation of the eyebrow. You cause the frontalis to be active here. So there's some influence of the frontalis, a centimeter and a half, almost 2 centimeters round, and that will influence the last line. But as you can see, I'm in the middle line. She's got another line over here, I'm here, and look how far away I'm from the orbital rim. So I'm allowing the frontalis here to pull up like this.
So what Nino said is it's a compensatory effect of the frontalis. When you are weakening some part of the frontalis, the rest of the frontalis that was not affected by the botulinum toxin is contracting. So
this is 1 unit in the center, so we just get these high wrinkles. We're not going to drop because we're going to also treat the depressor supercilii, which is coming right now. Superficial, because it pulls down. I hope you can see what I'm doing. Right here, very superficial, and it's 3 units. 3 units, and I see how I pull away from the orbital rim. Okay, and I didn't decide on how many units I'm going to do here. I think I'm going to do 5, right in the procerus. All right, relatively superficially.
You see, Nino is injecting on the insertion of the procerus, just on the insertion. How many units?
In the middle, I think.
In the middle.
I did 5 units.
Okay.
And then Français? No, not Français, Français. Français. Yeah. Well, Anglais. No, Français. Okay. Up. All right, so I feel the strength of the corrugator right there. So I go, look, 45 degrees, 60 degrees inside the muscle, almost to the, I'm going to do 6, almost to the bone, and we finish. I need another one, please.
How come you go so deep in the insertion?
Because the corrugator right there is coming off the muscle, off the nasal bone, and now it's going to be very superficial.
Yeah.
Français. Okay, now you can see the tail.
Yeah. On the tail, you're superficial.
And I'm very superficial. Here's the dimple of the corrugator. So we lift up.
So when Nino said,
and I just do very superficially in the eyebrow, and you will see it's very superficial. And that's all. That's all we need. So I come around this
Nino
other way.
injected first, deeply in the muscle belly,
Right.
and then on the tail, very superficial, with a kind of mesobotox
And then
technique.
up, okay, here we go. And so, see, I'm protecting the brow, and we go inside the muscle, about
Yes.
45 degrees. I do 6 units.
Relâche, comme ça, tu me donnes dessus.
Okay. And then français. Français. Here. So you see the dimple, and you're right above the brow with 2 units.
Les épaules, baisse les épaules.
Bevel up, very superficial.
Yeah, and you want, I'm sorry.
You want a little bleb.
Little bleb.
Little bleb,
And you know you're superficial enough.
yes.
And you go gently.
Très bien, Patricia.
Okay? There.
It's good, Patricia.
All right.
All right.
Any other questions? So we did this. We did the.
Then the
Okay.
mentalis, a little bit of mentalis.
Well, okay. We can do the mentalis. Let's do the filler now.
Yeah,
I'm not going to do too much of the mentalis. I usually put
8,
4.
4.
4, no more than 5. I'm going to do 4. And then I do the lips, and that's it. I mean,
That's it, yeah, no more.
Yeah, say whistle while you work. Whistle, look, whistle while you work.
Yeah.
I'll show you something else. Whistle while you work.
Ruisseau.
While you work.
While you work.
Yeah, do that again. Whistle while you work. When I'm just showing it, she's not doing it, but when patients do this, the depressor septi nasi is strong, and the nose goes like this. Whistle while you work. Say it again.
Redis.
Ruisseau while you work.
Just a little bit, but not enough to give her
inject.
the pain of the injection. So do it again. Whistle
Ruisseau
while you work. Okay, these are the things that I hope you take home with you. These are my tricks. Okay, but I'm not going to treat her because it's too painful. But patients who have that and their nose goes up and down, they're very embarrassed by it. So give me a big smile. No, it's okay. Smile. Un grand sourire.
Grand sourire.
Ferme la bouche.
Et grand sourire.
Un grand sourire.
Ferme la bouche. Ferme la bouche et grand sourire.
No, show me your teeth. Les dents.
Les dents. Ah.
Les dents,
Okay, no. So if she had an asymmetric smile, I would treat the DLI. A lot of times the smile is asymmetric, her smile is perfect.
Yeah.
So these are the things that I go through with the patient around their face to see if there's asymmetry. There was asymmetry on the brow. Many times there's asymmetry around the mouth. The nose goes up and down. There's a lot of different things that patients have that they do not know. When you point it out, then they say, okay, how much we treat, 1, 2, 3 units down in the lower face is all you need. For an asymmetric smile, just 2 units in the DLI will lift it up and make it symmetrical with the opposite side. So it's very good. So what I'd like to do is have her sit up because we need the gravity to see. I would like to start treating her. She's got good malar prominences. She's been treated before.
yes.
Yeah, so the nasolabial fold is okay. She's starting to have some marionette lines, and so maybe we should do a little bit marionette lines and the prejowl sulcus, and if we get time, we'll do the temples. But let's do the lower part first. Are there any questions? No, I'm not going to mark anything anymore. So I just need a little alcohol and a little, I'd like calcium hydroxyapatite in the lower face where there's bone support. Around the lips, around the eyes, always hyaluronic acid. But I think we're going to use a little bit. We're going to straighten out her chin. We're going to make her chin look like this.
Yep.
And we're going to, just a little bit here with the prejowl sulcus and the marionette lines, radius. So we're going to use calcium hydroxyapatite. Did we? Radius, yeah. Yeah, so where is it?
It's radius.
Right in here? Are any questions? Does anyone use calcium hydroxyapatite? I usually like to use that in the lower face and the mid face. And then, like I said, periorally, I use hyaluronic acid on the nose, hyaluronic acid on the temples.
What is your dilution for the calcium hydroxyapatite, Nino?
It comes already with lidocaine.
Yes.
Sometimes I put a little bit in, sometimes I do not. Maybe we can bolster this up.
Yeah.
She does have some scarring, so maybe I start here and I go down. We're mixing something here. Okay, so how much lidocaine did you put inside?
So you see, it's very important when you do this kind of planning to know how to inject, and the technique makes a major difference. So you need to study the anatomy of the patient, the deep injection, the superficial injection. So this makes a major difference. And the question we received before, how come that if you inject the frontalis, you are not lowering the eyebrow? It is because we leave some of the fibers still active, weakening the other, so we have a compensatory effect where we want. So this is what Nino just pointed out. Now.
All right, so I see a little bit of a scar here. Maybe bring your head. So it's always best to see the patient sitting up perpendicular to the ground, because this way the gravity shows you where the defects are, and this is how I treat the patient. So I'm going to do a little bit here, because she can use a little support here, and I'm more and more anymore, you go very slowly, by the way, you never should be in a rush, and I usually would do this after 2-3 weeks. She comes back to see how the botulinum toxin took place and the result. So I'm just going to do a little bit here to give her a nice little curvature of this area where she had the scar. And then the calcium hydroxyl apatite will absorb a little bit. We're going to, maybe she can sit up a little bit. Let me see. Yeah, no, just see. So I'm going to go along the pre-jowl sulcus. And again, I'm appreciating more the tower technique because I get less ecchymosis, even though I go in more than once. I used to inject the entire face in one puncture. I used to go here, and I used to do the entire face. And now I think I like the tower technique better.
So how long does it take for the biostimulatory effect of the calcium hydroxyapatite to be evident, Nino?
Well, the patients leave. I need a little bit more. The office, now I massage a little bit.
Okay.
They leave the office, and it's very evident. And sometimes there's extra edema because as you manipulate the product, you can see the jawline is nice and straight. As you manipulate the product, it causes more edema, more tissue edema.
Yes.
So the other point I'd like to make is I'd like to do a little bit at a time. We don't have to have very obvious changes that we see. The little changes that you can create, that you do create, the patient sees automatically. A lot of times, okay. Good, new needle. Always a new needle. So there's still a little depression here, but I'm not going to chase it. I'm going to do a little bit here. I'll chase it at the end because, as you see, by the time I finish, yeah, I like the patient sitting up the way she is. By the time I finish, the edema will collect. See, that's nice. The edema will collect, and it'll be more obvious if that scar, I think that scar is a long-time scar. She had it as a child. She doesn't understand me, but ask her if that scar was from childhood.
Non, c'est l'année dernière. On a des fils.
Oh, filler. Well, okay, I'm not going to. For sure, I'm not going to chase it more. No, it's spuddy.
Nino, we have 7 more minutes.
How much time do we have?
5,
7, 8.
7, 8 minutes.
Well, we should have some questions.
I think that's Nino.
So here, yes. I'm doing the marionettes now. Do you see how nicely just 1 point, the lifting of the skin with this tower technique? I think it's really much better than the fanning technique in my hands anyway. And there's less trauma because we're less dissecting the skin, less, even if I have a cannula, there's less trauma to the skin. I'm just going to go in here. I want to bring this out, but I need another syringe.
So what about the edema that you develop after this, Nino? Sometimes we notice that with the calcium hydroxyapatite, we have a prolonged edema in these patients.
Yeah.
What do you give them? Do you give them something?
No. Just because I don't give them something because I don't see them. I tell them to come back in a month.
Ah, okay.
So I don't see it. But I warn them.
Okay, but you receive a lot of phone calls.
No.
No? They don't?
None.
They don't dare?
No.
Okay.
My patients are
Very good.
instructed.
I instructed, okay.
Very, very
See,
closely.
very important to pre-inform the patient.
Yeah, okay.
Yeah.
So a little bit, I'm surprised we don't have any comments from the audience. Nobody, everybody agrees to what I'm doing. Look at that mental fold. Look how we're going to make it disappear and make the chin nice and smooth. Look at that.
Excellent.
Isn't that beautiful?
Yeah.
And in time, it's going to be more and more. Make sure it's tight. No, I'm going to, yeah. Okay.
We just pre-evaluated the patient before, so.
Look at that.
Nino,
Look at the side, one side to the other.
Yeah.
Do you see? Just a little bit. Okay. Okay, here we go. Leonardo, go look in the audience. There's got to be a comment.
Oh, they are all, they're astonished to see what you're doing.
So the whole lower face is going to change. She's not going to recognize herself anymore.
So what Nino is doing is trying to smoothen this kind of, mental labial angle, which was very, very much pronounced. And she got almost, from this kind of deep wrinkle that you have here, is almost a scar. So Nino is injecting close to the surface right now, or no, deep?
Deep.
And then
deep.
on
But it pulls, it's again, the tower technique, it's just lifting everything.
Yeah.
It's a,
but
it's
in
a
the
generalized
middle,
line.
what do you do in the middle there?
In the middle. I'm going to go straight down.
Yes.
And look.
And then you withdraw the needle towards the surface.
Right, but you got to be careful, especially with calcium hydroxyapatite. You don't want to have bumps on the surface of the skin.
Yeah.
Because then they'll stay there for a long time. Because it's a very viscous, it's a very
material.
Yeah, robust product, and that's why I like it. I like it, a robust product on bony areas.
You see, as we discussed before, she improved quite a bit just working.
Right here,
yes.
right along here.
Yeah, the pre-jowl is perfect. The mandible is much straighter.
I have to do the
marionette line.
The marionette line on this side, and her nasolabial fold are fine. This scar that she had, or I thought it was a scar, it was an indentation, mostly gone. My temptation is to go a little bit here, but I may not. I can put a little bit here.
Yes, we need to conclude because the next session is coming.
Sorry?
Finish?
Yes, maybe
Finish?
the last words.
Okay.
We need to conclude. Yes, it's very interesting to see that what we have done with this patient, it's what we have seen earlier. We need to provide support for this patient. It's not only filling a fold and wrinkles. No. We need to provide the back this support to have the inverted cone of use. And so Dr. Benedetto starts with upper support with the malar and the submalar, a deposit in a deep plane to don't overfill the face, to don't make the face thicker, to don't block the muscle. And thanks to that, he provides the support in the upper part, and then in the lower part with a fold between the lip and the chin. It's very important area. It is anterior support, and it's really the key. Don't feel whole fold and wrinkles. Think about scaffold, support, columns, pillar. It's really the key for all our patients, but especially for these older patients, 65, 70, 75. So thank you very much, and we are going to, if you have more questions, we are ready to answer to you after this session, and we are going to go on with the next session about complications. Thank you very much. If you have a last word, Nino or Leonardo, if you have.
G prime hyaluronic acid to do what Nino is doing. Nino is just a preference to use this kind of different filler, which is calcium hydroxyapatite. But you need to warn the patient that sometimes you get this kind of hyper reaction.
I'm sorry to interrupt, but you cannot see the line.
No,
give it tomorrow. She will not have that line. The chin angle is beautiful, smooth. The marionette lines are gone. Just with a little bit, not even one syringe of calcium hydroxyapatite. I don't want to say the product name. We all have to keep a secret. I don't know what the secret is.
Of course.
But a little bit the malar prominence, and there was that indentation is very good. I have a little bit left. I think I'm going to do it here to bring this triangle. Oh, I have to stop. Oh, I have to stop. Sorry.
You did not hear me.